One of the things we see a lot is tendon pain, which is called tendinopathy. This occurs as a result of increased strain or load on a tendon. Tendon is a structure that attaches our muscles to our bones. Lots of people are subject to getting tendinopathy, ranging from older to the young, the weekend warrior to the elite sports person, and the relatively active to the relatively sedentary. There's lots of tendon problems that we treat around the body. Some of the common ones we see include lateral elbow pain, which is called tennis elbow, the Achilles tendon, patellar tendinopathy, which is jumper's knee, rotator cuff tendon, which is in the shoulder, the gluteal tendons around the hip, and also the proximal hamstring tendon around the buttock. Our tendons are subject to two kinds of loads. Firstly, it's tensile load, which is where the tendon stores and releases energy like a spring when our muscles are working. Second is compressive load, where the tendon can become compressed over a bony prominence secondary to positions or postures that we adopt, such as lying on our side, crossing our legs, squatting or kneeling. Our tendons can tolerate these loads normally without aggravation when the loads that are placed through them are consistent and regular. Tendons become painful where there's a sudden increase in tensile load, or even worse, an increase in compressive and tensile loads secondary to an increase or sudden change in activity, starting activity after a prolonged period of rest, or increasing in tendon loads secondary to muscle weakness. Other than loads, there are other factors that contribute to tendon pain. These include age and gender, activity and exercise history, general health, so in conditions such as diabetes and inflammatory conditions, menopausal state, increased waist girth and increased cholesterol, past history of tendinopathies, past injuries, and poor biomechanics. As our tendons are load-dependent structures, total rest is not an appropriate treatment for tendon pain and can actually weaken the tendon and increase pain. As a result, appropriate load at the appropriate time placed on a tendon can improve tendon pain and also the structure of the tendon. Research tells us that exercise makes up to 70% of the long-term and short-term improvement in tendon pain. Other modalities such as icing, taping, injections, stretching and massage, and machine-based interventions can offer a small amount of relief, but usually aimed at pain relief, which then allows the exercise to give us more longer-term strength and in the tendon structure. Research on lateral elbow pain or tennis elbow showed that over a 12-month period there was no difference in outcome between those who had cortisone injection and those who were in the wait and see group. Research also shows that exercise in tennis elbow significantly increases the longer-term outcomes and faster outcomes. So when we're treating a tendon, we firstly look at modifying the tendon load. This includes reducing the aggravating tendon load and adding beneficial load, which is usually an isometric exercise to help with tendon pain. From here, we then need to increase the strength of the tendon and the surrounding muscles by increasing our exercise appropriately. After that, to progress on through to sport-specific and work activities, we need to expose the tendon to these kinds of loads so that it builds up resilience and strength in able to tolerating those loads. Along the way, we can also utilise medical interventions to help with some pain relief and also addressing the risk factors that were previously mentioned. So these early exercises are some isometric loading on the lateral elbow tendons, which can be very helpful in the early stages of lateral elbow tendinopathy. From here, we can progress to some through-range strengthening exercises, which is our next step into our exercise program, looking at through-range wrist extension and also looking at our elbow rotators. Due to the nature of tendon pathology repair, benefits from treatment can take weeks but usually months to see good long-term benefits. This is something that patients need to be aware of and have this expectation, as often people go looking for short-term solutions which then don't afford them good long-term results. As such, treating tendon pain needs a good thorough assessment of all the risk factors that we have mentioned and an appropriate and specific targeted program addressing these. When you do that, you can get back on board doing the things you love to do.